Welcome to my YouTube channel. Hey everyone, so today we're going to be talking about fibroadenomas, and for those of you who are unfamiliar with that term, it means a benign breast tumor. I was diagnosed with these when I was about 16, and I just happened to be downstairs sitting at the kitchen table, and my mom was talking about her breast exam because she has had lumps in her breast, and I just happened to feel my left breast and I felt a lump, and I let her know, and then she took me to see a breast specialist, and what they ended up doing was an ultrasound, which is imaging, and they diagnosed me with multiple fibroadenomas, and I also had some cysts. So right away after they gave me the diagnosis, we scheduled a biopsy, and my first biopsy that I had was a bilateral breast biopsy, and they ended up taking out multiple lumps that were in my left and my right, and the biggest one in my left I think was bigger than the size of a tennis ball. So after they took the lumps out, they sent them to a lab to confirm the diagnosis of a fibroadenoma, and they recommended me to follow up with my breast specialist after the surgery and get ultrasounds every 6 months. So this has been something that I've been following since I was 16. So with them following these masses every 6 months, some of them have grown, and I ended up having to get multiple biopsies because these tumors kept growing in my breast. So I probably had, I want to say, like 5 or 6 surgeries total. I had about 3 with my first surgeon, who I absolutely loved, and he ended up retiring, and then I switched to another one, and he did 2 or 3 more surgeries in addition to them. And as I mentioned before, I also have had cysts in my breast, which are different from a fibroadenoma. That's just a fluid-filled sac, and what they do is they insert a needle into your breast and they aspirate, meaning they pull out the fluid and they get rid of it. So I've had that as well. So to make a long story short, the last surgery that I've had on my breast was, I want to say, 4 or 5 years ago, and since then all of my masses have been stable for the most part, meaning that a lot of them haven't grown. So they just recommended me to keep getting the ultrasounds to follow up. However, there is one spot that's kind of grown on and off the last couple of years, and they had recommended me, the radiologist, to get an ultrasound guided needle biopsy, and with that they numb you up and they insert a device into your breast. They take out a sample, send it to the lab to confirm whatever the diagnosis is. But I declined to get that biopsy, and instead they also said, I can just monitor it every 6 months. So it was pretty stable up until now. 5 years later, that same spot that they recommended me to get a biopsy of a couple years ago has actually grown. So I have another breast biopsy that I'll be going through, and the surgery is scheduled for next Thursday. So I'll be vlogging that experience and taking you guys along with that journey. But I just wanted to make this video to kind of educate you guys about what fibroadenomas are, and it is important to do your breast exams every month, meaning you take your hand and you feel under your breast tissue and in your armpit, and if you ever feel any lumps, definitely go to your either your gynecologist or your primary care physician, and they'll refer you to a breast specialist who can order some imaging to look at that and see what exactly it is. So some of the pre-op instructions that they gave me was a week prior to stop taking any Motrin, which is ibuprofen, because that contributes to bleeding during surgery. And I also had to stop my vitamins and supplements because they can contain fish oil, which also contributes to bleeding. And 2 days prior, I have to wash with this HIPAA cleanse, which is a surgical wash. It has chlorhexidine in it, 4%, and that just helps prevent any infections before the surgery. And then midnight, the day before surgery, which will be Wednesday night, I can't eat anything past midnight, but I can drink clear fluids like they said, water, Gatorade, or 7-Up 4 hours prior to surgery. And those are pretty much all of the pre-op instructions that they gave me. I'm just waiting for the nurses over at the hospital to give me a call, and they'll go through like my medical history and any medications that I'm on, and just some questions in regards to anesthesia that I'll be receiving. Everyone, I am on my way to the hospital to get my COVID test. It's 2 days before my surgery. Surgery's on Thursday. Today's Tuesday. So yeah. So I just got my COVID test. It's 2 days before my surgery. So tomorrow they're going to call me and let me know what time my surgery is on Thursday. I'm just so ready for Thursday to be here so I can get this surgery done with. Today is December 8th and it's the night before my surgery. I'm just about to drink this protein shake because I can't have anything to eat or drink after midnight, and my surgery is at 1 p.m. tomorrow, so that's a really long time to go without drinking or eating anything. So I will see you guys tomorrow morning. Good morning, everyone. Today is Thursday, December 9th, the day of my surgery. I'm just about to shower with this Dial soap. It's antibacterial soap, and this will help prevent any infection from the surgery. Good morning, everyone. I'm just about to head to the hospital for my surgery, and on the way I'm going to go by Dunkin' Donuts to get the nurses some donuts. All right, I'm on my way to Dunkin' Donuts to get the nurses some donuts, and after that we're headed to the hospital. So I just arrived to the hospital, and this is my room. It's pretty nice. So I'm just gonna put my gown on and my socks and wait for my nurse to come in. So I just changed into my gown and my socks, and I spoke with anesthesia, and my nurse just started an IV. So I'm just waiting to talk to my doctor, and after that they're gonna take me back to the OR in about an hour. My surgery went well. I'm in the recovery room. Just have some ice over the incision, and I should be going home soon. I am back home now, feeling just a little bit sore. My IV infiltrated during my surgery, so they had to start another one. But other than that, the surgery went great, and I'm just gonna get some rest tonight. So my plans for the evening are just to relax. Don't forget to like this video and subscribe to my channel.